Welcome to the Reykjavik Grapevine Newscast. I'm Poppy Askham and you join us by Tjörnin. Okay, so the news this week is pretty heavy. We are facing a lot more infections since we last talked. The current number is 39 active infections. That is the highest number since around mid-May, and things are looking a lot more serious. The other really big piece of news is that we have had our first hospitalisation since mid-May. The individual is in Landspítali. They are not in intensive care, but as a result of having someone with coronavirus in Landspítali, the whole hospital is now in crisis level, which is very serious and means that there are changes to visitors' rules. But yes, back to the numbers. 39 active cases, 28 of those were domestic infections. This is really concerning because domestic infection levels have been really low until around 23rd of July, and there's a sudden spike. So between 2nd and 23rd of July, we had no domestic transmissions. And then this last week, we have had a whole host. We've had 28. So there are also currently 215 people in quarantine, and the current domestic transmission rate is 7.1 per 100,000 over the last 14 days. So what that means is there are a couple of group infections. There is one which is around 24 people, which appears to be centered around Akranes, but also with links to Reykjavik. It's a bit of a muddled situation. The tracking team are working to find everyone involved in this group infection. There's also 4 that appear to be related to a possible tourist, and one that we do not know the origin for. There are several missing links that the infection tracking team are trying to figure out at the minute, and that is the real cause for concern. The chief physician at the infectious diseases department in Landspítali this morning said that he thought that numbers of infections would be much higher than the official numbers at the minute, and that there may be several individuals who have not been diagnosed. Also, Kari Stephenson weighed in to give his opinion, and he had very somber words to say. He said it looks like it is that he's concerned that it could be spreading at lightning speed, was the phrase, through Icelandic society. So this is looking like it could be a potential second wave. So in response to the situation, the government has put in place a whole host of tougher regulations. We are basically going back to May in terms of infection numbers and in terms of restrictions. So what this means is, in a press conference this morning, the health minister announced that the gathering ban, which is currently at 500, from tomorrow will be down to 100, so a max gathering of 100 people. Also, 2-metre distancing, which has been a guidance, is now a rule. So if it's public space, if it's a gathering, it has to be 2-metre distancing. In places where that can't be achieved, for example, public transport, there are going to have to be masks. Now, this is the first time we have had rules about masks in Iceland. Throughout the whole epidemic, we have not had to wear masks, so this is a very new thing. So don't get on Strætó without your mask from tomorrow. And then the other thing to know is that if businesses can't have 2-metre distancing or sanitize commonly touched surfaces, they will be required to shut. So these rules are meant to be around for about 2 weeks. That would be until after Merchants' Bank Holiday. and then we will see if the infection has been contained, if the outbreak has been contained, then they will be removed. But obviously the whole situation is very fluid. Another thing that will be interesting for travellers to note is that if you are wanting to come to Iceland for longer than 10 days, you will need to do 2 tests. This doesn't matter where you come from, you will have to do 2 tests. The second test will be about 4 to 5 days afterwards, and until you've got the results of that second test, you will have to follow these homecoming contagion rules, which is a form of modified quarantine. It's not the strictest. Basically, you can't be in groups of more than 10. You should avoid public spaces, and also elderly people and people who are of high risk, and keep 2-metre distancing. So that is a very new rule. The Prime Minister in the press conference today, when quizzed by journalists, said that she did not believe that Iceland had acted too quickly in reopening its borders to tourists. However, it is a very contentious issue, and there will be lots of people who will be coming out to criticise this move, particularly as this new spike comes 2 weeks after 4 safe countries were allowed to travel to Iceland without testing or quarantining. That was Finland, Germany, Norway and Denmark. So as a result of all these new rules, over Merchants Bank holiday, there are going to be lots of cancelled festivals. We've already seen Inipukin be cancelled today, the Westman Islands National Day Festival, which was cancelled a couple of weeks ago, in fact. And there have been several other things cancelled up in Akureyri, in the Westfjords. Sports matches have also been cancelled. The police have asked sports match organisers to postpone them for at least a week, as it appears one of the group infections is linked to a sports tournament that was held in Reykjavik last weekend. So yes, a very serious situation. The new restrictions have been described as a handbrake to try and prevent this outbreak becoming really, really serious, but it is one to watch. Thank you for watching this update from us at the Reykjavik Grapevine. Keep up to speed with all the developments on our website. Support us through the High Five Club and like and subscribe. Thanks for watching.